Welcome to the Peak Performance Podcast, your guide to optimizing your life one health tip at a time. This podcast is designed to entertain and inform, not to provide medical or health advice. Always consult your doctor when it comes to your personal health or before you make any changes to your diet, exercise, or lifestyle.
Ladies and gentlemen, welcome to the Peak Performance Podcast. I'm Coach Kyle.
And I'm Dr. K, and join us today as we talk about manipulation therapy and its many names, forms, structures, meanings, techniques, healing, you name it, we're going to get into it.
Manipulation therapy. I mean, I don't even know what you're talking about, Dr. K. Can you explain just a bit more about what this might encompass?
Yeah, so the main focus we're going to be talking about is things like craniosacral therapy, Reiki, osteopathic manipulation, some chiropractic techniques, some myofascial release, and then there's many names for this stuff. I just listed the most common ones that people have most likely heard of.
Very nice, very nice. So do you want to dive in, or should I comment on my lack of a fire detector up here and my cord hanging out of my ceiling?
Okay, no one wants to hear about that, so let's just keep rolling.
It was beeping in the middle of the night, folks, so sorry, deal with me. So what therapy would you want to start with, and why should you do that therapy?
So it's honestly hard to explain. The way I kind of explain this to people is all the people that are doing these techniques. I kind of explain we're all looking at basically a ball. Imagine a ball, and we're all looking at from different sides of this ball, but everyone has the same idea and focus. And the idea and focus is to restore normal anatomical function through the use of manipulative technique. And whether that's aggressive techniques, like you go to the chiropractor and they crack your neck, or very gentle and even hands-off therapy like Reiki, or something in between like osteopathic manipulation, the idea is the same. Get everything straight so that the body can continue to function.
So basically it is different techniques of making the body move in certain ways that establishes it in proper form and function.
Yes. So, I'm a DO. I'm trained in osteopathic manipulation. Most of that came not from my medical school. In medical school, they teach just the overlying stuff. Most people, unfortunately, ignore it because they don't care. And then, I went out and got other training along with training I had before med school that I'll also talk about. But basically, the idea, this is, I think, the most important concept that they teach in the osteopathic school, is we're in what's called a Z formation in our body. It's, continuing Z. And the idea behind it is your body is basically a bag of meat controlled by a brain. And the brain needs your eyes to be straight so it can interpret incoming images. So your body would do anything and everything, including crippling you, to make sure that your eyes stay level. And so we live in a Z formation where you tilt a little bit to the left and a little bit to the right, and a little bit to the left and a little bit to the right. And that keeps your eyes straight. And then let's say you sprain your ankle and now you're suddenly limping. And so now instead of having a Z, you're a little bit more lopsided. So what your body would do is throw out your back or your hip on the opposite side to create a new Z formation to once again make sure your eyes stay level. And let's say your ankle sprain goes away a couple of weeks, but your hip stays out. Now your body's going to throw out your shoulder or something to keep you in that Z. So the idea behind the manipulation techniques is to put your hip back in place, put your shoulder back in place, put your ankle back in place into what's called normal anatomic position for you to put you back into that Z formation. Does that make sense?
Yeah, that makes a lot of sense. So basically, it's a double-edged sword that the body is conducting here. It's this whole, like, we are saving our function so you can literally keep your eyes level and still be able to function at all. But in turn, we're kind of trading that with compensations that cause chronic pain and chronic issues down the road.
Correct.
So by manipulating the body, basically we can get rid of the chronic and make it more likely that the eyes and the central processing center stays level.
Yes.
Okay.
That's the base idea behind treatment. Now, a lot more goes into that. There's people out there that they can manipulate nerves. There's people that can manipulate organs. There's emotional healing involved in this, along with physical healing. So There's a couple different ways to approach it. The view that most chiropractors, for example, take, and this is what they're taught, is if you adjust the bones, the tendons, ligaments, and muscles will follow. Whereas other aspects, for example, some aspects of osteopathic manipulation or craniosacral therapy, they view it more as adjust the muscles, tendons, and ligaments, and the bones will follow.
Got
So,
you. So what do you think is the right way to do it?
so in my opinion, I've found that adjusting the muscles, tendons, ligaments leads to longer lasting results because I always explain to people like this. Imagine that this pen is a bone, right? And on each side of the bone is a string. And every bone has a muscle on each side of it. That's how we move, right? The bones themselves are basically inanimate. They can't move, they can't do much on their own. So if I twist this side, if I create a spasm in the muscle, it's going to move this way. So if I take this pen and yank it back towards the middle, but this twist is still here, what's going to happen to the pen?
It's going to go back.
Yeah, it's going to shift right back here. But if I release the spasm, the pen will move by itself. And that's the idea behind how I personally treat people is we release the issue and then let the things that are stuck because of the issue move on their own.
So the chiropractic, I guess, thought to this would be that if you move the bone back into place, that spasm, it'll fix some of the issue, but hopefully the spasm will resolve because it's not crimped. But sometimes it doesn't, and it pulls the bone back.
Correct.
Okay. So is this why a lot of chiropractors recommend, like in their perfect world, they usually recommend you go get a massage right before you get an adjustment? Is that kind of why?
Yeah, if you can get the muscles to relax and all they do is shift the bones back in, muscles don't have that reverse tension to pull the bone back out, then yeah, most likely the therapy will stick.
Yeah, that makes a lot of sense.
Yeah, the unfortunate part is, how many people do you know that have to see their chiropractor every single week for their back issues?
Yeah, a lot of people. Actually, that I'm in that group, but I view my chiropractor more as a pit crew. Like the goal is just to keep me in the gym, lifting a lot of weight, moving. Like it's literally, I know I'm going to be back next week, so just keep me relatively in a good condition so I can get back at it. And then I use a lot of other therapies like stem cell treatment and massage and craniosacral and myofascial release to do a lot of that longer term work. But the chiropractor is my pit crew, if you will.
Yeah, absolutely. And so then we go from chiropractor to what I think is almost the opposite end of the spectrum is Reiki. Most people have to some degree heard of Reiki. The idea behind Reiki is it's energy healing. Our bodies, they are basically energy, vibration. You have to kind of open up your mind to that concept, but energy and vibration is the idea behind Reiki. And it's the idea that, trauma creates disruptions in energy and vibration. So by releasing those trauma energies, you can release the whole body. And so Reiki can be done hands off. The way Reiki is originally taught, and this is, it's called Reiki. Is it Japanese or Chinese? I can never remember. Japanese. This has been around before books were written. Before they had paper, Reiki existed.
Right.
So
I think that's a good point to talk about because a lot of these things that were happening for health and wellness forever ago, before we had well documentation of them, are things that now are being documented by science to be very effective. So we usually should learn from our ancestors because they usually knew that what they were doing was beneficial.
Yeah. They may not have known exactly how or why, but they knew it worked. And truthfully, that's the most important thing, is not necessarily why does it work, but that it does work.
Okay, so you want to use energy movements or something like that to clear traumas. Can you break down a little bit about like how it's actually done, what it looks like?
So it's very gentle. Most of the time it is hands-on. It's very gentle, hands-on manipulation. I do what's called craniosacral therapy, which is it's somewhere in the middle. Technically, it's osteopathic manipulation therapy, but it's really craniosacral therapy. It's gentle, hands-on manipulation. It's ounces of pressure with basically gentle encouragement of things to move, release, and go. So it's a little bit more asking, not telling.
Yeah. When you say that, what comes to mind is lymphatic massage, and that differs from this, right?
Yeah, the idea, it's kind of like religion, really. The one overarching idea and then raindrops coming off of it. And many different strains of that are coming. So lymphatic drainage, it's just almost an idea off, it's a strand off of it.
Okay. So that's basically a way of viewing one of these manipulative therapies with a specific target of moving lymph fluid.
Yep.
And just so the audience knows, if you don't know what lymph fluid is, it's this fluid that moves to your body that's kind of like a bit of a detox system for your body, and it only moves through physical movement or something like lymphatic massage. So you mentioned like Reiki and craniosacral, and you mentioned craniosacral was more of asking, not telling, and light, gentle movements. Does that differ from like strict Reiki or?
Sort of, but not really. The idea, so the problem is as you ask more questions, the questions just broaden. So Reiki is focused on specifically energy, right? Whereas craniosacral therapy, sure, there's some energy aspects to it, emotional aspects. I know a doctor out in Phoenix, his focus is nerve manipulation. He's found that if he can treat the nerves, I mean, he can do crazy things. He can get wrinkles to disappear in people's faces just by treating the nerves. And like, you can see this wrinkle disappear before your very eyes.
Wow. So I should go out there to see if he can kind of get rid of my trigeminal neuralgia once and for all, maybe.
I mean, when you first called me about that and you asked, is there anyone that can manipulate it? I was like, yeah, him.
That guy.
The problem, and people will ask me, and I'll ask him. He's like, "How many treatments does it take?" And his answer is always, "I don't know. I have to see them. We have to do a treatment first and see how far we could get in one session." Because unfortunately, we're dealing with usually chronic issues, and so the body it's developed all these tight compensation patterns. You normally can't treat someone in one session. And unfortunately, we get people that come in, they're expecting to be fixed in one session. It's just not a realistic goal. If it took you months or years to get that way, you can't expect someone to fix you in a day.
Yeah.
Having said that, I don't necessarily believe in maintenance treatment. I believe in we treat the issue until it's gone. And if you feel good, don't call me, stay away. If something comes up, then call me, come back in. We'll fix whatever your issue is. And off you go until next time.
Yeah, I like that. I like that approach to it because I find that a lot of practitioners who do stuff like that really are very concerned with the reoccurring revenue and less about, hey, the patient is healed, they need this, or no, we're going to do maintenance just to prevent it, make sure it doesn't come back. Whereas I think if you treat it and you fix it or get it vastly improved, then that person will know when symptoms or issues pop back up and they can come back in, as opposed to sticking to a schedule that the practitioner thinks is best based on cash flow. And I know that's a cynical view, but that's just kind of how it comes off sometimes. I'm not saying the practitioners are like that.
Everyone has their different ways that they practice. And some patients, they're open. They'd rather stay ahead of the issue and they'd rather come in every week and make sure they don't have issues. And that's okay too. It kind of, just depends on personal preference and all that stuff.
That's actually how I approach it. Like I said, my chiropractor, I mean, I go in every week, and I might not need it some days, but he'll adjust me and I feel, that 5% better, and I hit the gym, and it's almost preventative for me at this point.
So I want to touch on it's kind of a tangent, but I really wanted to touch on this. It's called Craniosacral Therapy for Vision. And, basically, so side story is I see my optometrist every 6 months to a year, and my prescription keeps going down, which is, that doesn't normally happen. Normally, prescription gets worse over time. Mine keeps getting better, and he always looks at me, and he's always confused a little bit. He just kind of rolls with it at this point because I've been to him like 5 times. Craniosacral therapy or osteopathic manipulation for vision. So those of you that wear glasses, you know that when you go to the eye doctor, they give you their little fancy lenses. They put you in front of the eye chart and they say, what's better, 1 or 2? 1 or 2. And they keep flipping through lenses until eventually you say, they look the same. And that's pretty much when your prescription is set. And what they're doing is they're just slowly increasing your prescription until they find a lens that works for you. And unfortunately, there's 2 problems to that. One is if I gave you a pair of binoculars, you'd see even better, but it doesn't necessarily mean it's good for you. And then two, if they bring you the 20/20 vision with glasses, your eye is a muscle. And what happens to a muscle that doesn't have to work? It atrophies.
Fatigue.
Yeah. So if you're brought to 20/20 vision with glasses, your eyes, they don't care anymore. They just stop working. So we need to rewind a little bit and talk about how glasses are supposed to work. So for people like Kyle that don't wear glasses, their eye is perfectly round. So light comes in, it hits the back of the eye where the optic nerve sits, it hits it perfectly, and goes on the nerve and goes into your brain to process into vision. For people that wear glasses, the eye is not perfectly round. And so what happens is when light hits the point, instead of hitting the back of the eye where it needs to concentrate, it kind of misses. And so you're getting enough scattering that you can see something, but it's not clear. The image is basically very pixelated. So what glasses do is that they focus the light into a more concrete beam to hit perfectly in the back of the eye. The problem is when you go to the optometrist and they do that A or B thing, they're not necessarily looking for what specifically focuses the light. They're more so looking for what can your body, it's kind of a mix between where the light hits and what your body can adjust to. Because the muscles around your eyes can force the eye to reshape enough to move to meet the light. Does that all make sense so far?
Yep, I'm tracking.
So if you go back to that Z compensation pattern, so when those muscles in your eye, when they have to go into spasm to move your eye, they end up pulling on your skull, and that pulls on other muscles, and it just creates bad compensation all the way down. If you find a really good practitioner of manipulative therapy and you have them take a look at you with glasses on and glasses off, and if you don't have properly fit glasses, they'll actually be able to notice posture changes, anatomic changes in you.
Wow.
Most things, they're pretty subtle, Yeah, the average layperson would never notice, but people with a good trained eye will be able to pick it up.
Wow. Okay, so if generally, glasses are prescribed maybe a little too strong or a little too well, what's the approach? I mean, how do you change that?
So this is where I prescribe glasses to my patients myself, and we do it through Craniosacral Therapy. And I learned this from that same doctor out in Arizona. And there's a few different doctors that teach this, and I'm sure more that can actually do it.
Can we?
He's the only one. I'm sorry?
Or can we link to the doctor in the show notes? Are we allowed to talk about who he is and shout him out?
Yeah, sure. His name is Dr. Steve Davidson in Phoenix, Arizona. We'll put his website down there.
Yeah, and we'll find any social media he might have, put it in the show notes if he's got that too.
He doesn't have any.
Well, website it is.
Website it is. So if you're near him, go see him. If you're near me, come see me. We can both do it. But basically, so we have to go back to a second concept now. So modern medicine believes that the bones of the skull are fused, and that's wrong. The bones of the skull are actually hinge joints with a couple millimeters of motion. They can move very, very slightly. And the reason so there's a study done many, many years ago, like hundreds of years ago, where they took cadavers and they looked at the skulls and they found that some of them, the bones were fused, some of them, they weren't fused. So they assumed that the ones that weren't fused, there was something wrong. And so they discarded those from the study and only studied the fused ones. And that's where the idea that the bones of the skull are fused came from. And if I can find that study again, I haven't seen it in years, but if I can find that study again, we'll also link it in the show notes. So that's where the idea comes from. So now we have to realize that that study was flawed. The bones of the skull are hinged. And so you can actually, people that are good at craniosacral therapy, they can actually feel the motion at hinge joints and they can feel degrees of movement. And so when you take glasses and you put them on and the eye adjusts, you're going to get a little bit of motion. So when I prescribe glasses, I have the whole eye, just like the eye doctor, I have all the lenses. And so we start with your prescription and we feel how your skull moves. And then we change out your lenses until we find one where your skull doesn't need to move, where your eye muscles aren't straining to meet that lens. Oftentimes you end up at 20/30 vision, which is fine. You can easily live with 20/30 vision, and that's where you want to be. So your eye muscles have to work a little bit. And so the way that goes, before I met him, my glasses were at negative 5.5 and negative 475. And I had negative 1.5 astigmatism in both eyes. I'm now down to 375 and 325, a quarter of astigmatism and no astigmatism.
Wow.
And over time, as you stay on top of those treatments, you can get your vision to keep improving. So my long-term goal is no more glasses.
That's impressive. You heard it here, folks. 200 podcasts from now, we expect Dr. K to have no glasses.
I mean, that's my goal. I can now, it's not a good idea for me, but I can drive now without glasses. Whereas 3 years ago, zero chance.
That's impressive. I mean, that's a lot of improvement.
Yep.
Along with this kind of treatment, I just want to hop in. There are a lot of eye exercises you can do to strengthen your eyes. There's one with like beads on a rope that you tie onto a door handle. You train your eyes that way. There's like, I think it's called like cupping or something like that, where you cover your eye and you blink. And there's a really good book about all these eye exercises that can actually help that process along of improving your vision. If I can find it, I'll put it in the show notes for you guys. You can link to it there. But that's the biohacker side of kind of helping out these treatments.
Yeah, no, absolutely. And, what people have to realize, I'm treating my eyes myself all the time. And so if that's a goal that you also want to accomplish, you would be seeing me rather often.
Yeah, that makes sense. So did we cover the vision pretty well?
We covered the vision. I'm glad that we got that one out of the way. That's one of my favorite side tangent jobs to do, is to prescribe people glasses. I don't do it often, but I find that a lot of fun.
Yeah, I mean, I'd like to tell my story about this. I have good vision. Like, my vision's crystal clear. Never had an issue with it. But I went to see this guy in Florida, and he's retired. He's one of these older chiropractors that is just a wizard. I mean, he's doing things that chiropractors have lost, like techniques that are not taught in schools anymore. And he's just crazy and very intuitive and can feel things. And he was like, your sutures in your head are a little bit off. So let me do some craniosacral on you. And then I'm going to go in your mouth and do, puts a glove on, does a little adjustment in my mouth. And he's like, when I do this adjustment, your vision is going to improve. I was like, my vision is fine. Like, I can see well. And he went and did it. And I'm not even joking you. I opened my eyes and I could see every speck of dust on the chandelier. And it was like, I was blown away because I see very well already, but it was like, holy smokes. I was like lasered in. It was very impressive. It was a noticeable difference.
Very cool.
Yeah. So that's my vision story on that. If you're ever in Lakeland, we should go see the guy. He's pretty cool.
Yeah.
So we talked about manipulative therapies, hands-on. We talked a little bit about chiropractic, a little bit about Reiki, a little bit about craniosacral for vision. Do you mind talking about hands-off a little more? Because I don't think we went into that in much detail at all.
Hands-off it's unfortunate. It's the most difficult thing for people to conceptualize, because their idea is, how can you treat me without touching me? And so that's one of the tenets of Reiki, is that you can manipulate energy from a distance, because it's really asking, and through that. And I'm honestly not the best person to explain this. The idea would eventually be to get a Reiki person on the podcast with us. My wife is in the process of learning Reiki, and maybe when she's done, she might be willing to come on. Unfortunately, I don't want to talk too much about it because I can't explain it well enough. I know it exists, but I don't know how.
That's fair. So, and you also mentioned a couple times emotional healing, emotional releases. Is this something you see with your osteopathic manipulation or your craniosacral? People have emotional reactions to this?
Yeah. So through my journey, I've trained with a lot of different people, some doctors, some not doctors. And actually, let me touch on that first. So craniosacral therapy, you don't have to be a physician to learn. This all started, it really mostly came about, a Dr. John Upledger out of Palm Beach Gardens, Florida. He started the Upledger Institute, where he said, I will not only teach DOs how to do these therapies, I will teach anyone that is willing to learn. Massage therapists, nurses, you name it. Anyone with a license to touch people was allowed to come to his classes. And so from there, that's where it really bloomed into. I know tons of craniosacral therapists who aren't physicians. They're not chiropractors. My dad, for one, is one, for example. He learned craniosacral therapy, and that's what he does up in New Jersey. And he's quite good at it. And he started teaching me, on friends and family when I was like 12. And that's how I got so good. Was I started a decade before I went to medical school and then continued it on through. So I just want people to understand that you don't necessarily have to see a doctor for this. There are many good practitioners that don't have that doctor title.
Yeah. Is there any way or advice you can give to the audience on how to find a good practitioner?
Honestly, word of mouth is probably your best bet. If you know someone that has had really good success with someone, they're probably pretty decent. Whereas, if everyone's like, wow, they suck, I probably won't try them. But I think the same thing applies for most things.
Yeah.
Word of mouth is usually the best.
Yeah, that makes a lot of sense. Okay.
So back to your emotional question. So I see it, I treat it. Craniosacral therapy ties in this thing called neurotherapy as well, a couple other different healing aspects. The idea is that emotional trauma can create physical impressions. And so everyone packs their emotions into different parts of their body, basically into their weak point. When you were a kid, you broke your shoulder, and then that could be your weak point the rest of your life, because the body tends to unfortunately dump on the weak parts. That's just how bodies work. It's like, well, the shoulder's weak, let's keep dumping all of our trauma onto there. And so a lot of emotions end up getting tied into it. And so as you release the physical restriction, emotions can actually come up. And I ask people a lot of times, you don't have to tell me, but let me know if emotions start coming up for you, because then that becomes another thread we have to follow in the process of treatment.
Interesting. Very interesting. I can see how this would be hard for people to comprehend, because it doesn't make a lot of sense, like logically on its face. But you got to remember that the body is not just a sack of meat. It is energy. It is life. It is life force. And energy is a huge key on how our body functions, and especially quantum energy. And there's things that we can't see that can pile up and affect us in our body in ways that we don't even realize. So for the energy aspect of things, I actually have heard of practitioners, like Reiki practitioners, who can like almost see the energy. These people are very, very few and far in between, but they can actually see what they're working with. They can see the hot spots, and they're able to kind of push and move that out. Have you heard of that?
Yep. And I'm one of those people, is that a lot of my treatments are very vision based, and I can see the issue more so than feel the issue. So I completely agree with that.
Very nice. Very nice. Anything else that we should cover on manipulative therapies? Ooh, mouthful.
No, I think that's a pretty good overview. I think, further episodes, we'll definitely get some guests in to discuss some of this stuff. People that are experts in their particular niche field, and kind of go from there.
Yeah, that sounds good. Well, excellent. Thank you, ladies and gentlemen, for joining us on the Peak Performance Podcast. My name is Coach Kyle, and you can find me at Toxin Free Kyle on Instagram.
And I am Dr. K, or the Osteo Doc, on Instagram. Thank you, everybody, for joining us as we discuss the manipulative therapies, and we'll see you next time.
See you.
Thanks for tuning in to another episode of the Peak Performance Podcast, your #1 resource for today's top health hacks and facts. You can follow us on Instagram at the Peak Performance Pod, or on X at Peak Perform Pod. You can also check out our website and weekly blogs at peakperformancepodcast.online. Again, thanks for watching, and don't forget to subscribe. We put out a new podcast every Thursday. The content of this podcast is provided for informational purposes only and is not intended for the purposes of diagnosing, treating, curing, or preventing any disease. Before using any products referenced on the podcast, consult with your healthcare provider, carefully read all labels, and heed all directions and cautions that accompany the product. Information found or received through the podcast should not be used in place of a consultation or advice from a healthcare provider. If you suspect you have a medical problem, or should you have any healthcare questions, please promptly call or see your healthcare provider. This podcast, including Coach Kyle, Dr. K, and producers, disclaim responsibility for any possible adverse effects from the use of the information contained herein. Opinions of guests are their own, and this podcast does not endorse or accept responsibility for statements made by guests. This podcast does not make any representations or warranties about guest qualifications or credibility. This podcast may contain paid endorsements and advertisements for products or services. Individuals on this podcast may have a direct or indirect financial interest in products or services referred to herein.